Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about how to manage indigestion with diet and lifestyle changes. Indigestion, or as known as functional dyspepsia, is a debilitating functional gastrointestinal disorder of the most common functional gastrointestinal disorders that exist, affecting 1 in 4 people. Indigestion often has the symptoms of upper abdominal pain or burning sensation. You feel full very early and you have an inability to finish a normal sized meal. Sometimes it goes along with anorexia or nausea or vomiting, bloating feelings, and even heartburn and regurgitation. Now, people are often first tested for Helicobacter pylori infection. If this is negative, treatment involves symptom management and sometimes proton pump inhibitor medications. Sometimes other medications as well that enhance gastrointestinal motility and even sometimes antidepressants. Now, risk factors for indigestion include obesity, smoking, behavioral issues with emptying, like you don't want to use certain toilets in different places, you only use them at home, recent antibiotic use, regular use of non-steroidal anti-inflammatory drugs, infections like Helicobacter pylori and Escherichia coli infection, Campylobacter infections, and Salmonella. But while it is a very prevalent condition, indigestion may also be a sign of an underlying condition that needs extra care, such as an infection or GERD, which is gastroesophageal reflux disease. Now, which I also made a video on this disease as well. If you're suffering from weight loss, difficulty swallowing, vomiting, it warrants further, sometimes often endoscopic evaluation. Although medical treatment offers symptom control, there are ways to go to the core of the problem and deal with it in order to prevent other issues from arising. So here are several ways to manage indigestion with diet and supplements. First of all, of course, you want to change your eating habits. You want to eat regularly. Just as regularity in sleeping is crucial for health, the same holds true for regularity in eating. When you wake up and eat at around the same time, this offers the body the regularity it needs to focus on health. This regularity helps reduce gastrointestinal symptoms, increases motility and stomach emptying rates. Studies show that there is a positive association between indigestion and irregular eating habits, including skipping meals. Aim to wake up and then consume breakfast, and then lunch and dinner and snacks in between regularly throughout the day. However, don't eat right before bedtime or a nap, unless you're sitting up during your nap. Your body needs time to digest, and when you lie down immediately after a meal, it causes some difficulty for digestion. You also want to avoid unhealthy fatty foods and consume healthy fats. Studies show that that indigestion of overly rich fatty meals delays gastric emptying and often causes indigestion symptoms in people with indigestion as well as in healthy people. The problem with fatty foods, mainly fried or heavily processed, is that the stomach works harder to digest them. They not only stay longer in your stomach, but it leads the stomach to produce much more acid. Now, although almost all people with indigestion associate their symptoms to fat-rich foods, it is important not to avoid eating healthy dietary fats, such as nuts and seeds. The nuts and seeds may have a positive effect on indigestion because of their high content of tryptophan, a serotonin precursor. It helps produce serotonin, a very crucial neurotransmitter involving regulation of gastrointestinal motility and sensory function. The stimulation of serotonin induces gastric smooth muscles to contract, which helps gastric emptying and helps improve abdominal symptoms found in indigestion. Now, nuts rich in tryptophan that are best to consume, the healthy fats, are almonds, cashews, pistachios. Can be consumed regularly, daily, as you reduce the other fat content from your diet. You also want to avoid specific foods. One study found that there are specific foods that indigestion symptoms, and these foods include foods that are rich in chemicals, also high in fermentable carbohydrates, high in caffeine, high in gluten, also processed foods that have added gluten to them, and concluded that wheat and dairy and fats, including dairy foods, play critical roles in the generation of indigestion symptoms, and avoiding them will help reduce these symptoms. You also want to avoid spicy foods. Chili pepper has an active ingredient that can exacerbate indigestive symptoms, making you more hypersensitive to pain as well. Now, foods such as licorice root are very important, are very healthy. There's a study that showed that licorice root has the ability to calm the spasms and minimize inflammation. Very important food to help prevent indigestive symptoms. Also, licorice significantly helped eradicate Helicobacter pylori infection, which may be a causative factor, as I mentioned, for indigestion. You also want to consume ginger. Ginger is very potent anti-inflammatory, also anti-vomiting properties. That's why it's taken mostly in the first trimester of pregnancy. It helps gastrointestinal motility. Studies show that people with indigestion that took ginger, it enhanced their gastrointestinal motility, and also significant improvement of symptom scores of indigestion, such as stomach pain, heaviness, early satiety, and regurgitation, as I mentioned. I recommend adding real ginger pieces into your tea, or buying sugar-free dried ginger and eating tiny pieces after meal. It is very, very strong, so tiny pieces is good, and it also removes the need for sweets after a meal, so it's very, very a good way to balance your eating habits as well, using a small tiny bit of ginger. Now, the essential oils of fennel, caraway seeds, or peppermint are also very beneficial. Fennel seeds is a very, very ancient treatment for indigestion. It has anti-spasmic properties. It is also believed to soothe digestive issues like bloating and cramping. Also, peppermint and caraway oil, 90 milligrams of peppermint oil and 50 milligrams of caraway oil were studied and found to relax smooth muscles, very beneficial. Also reducing pain intensity, also reducing the feelings of heaviness, and overall very, very helpful for people with indigestion. So to conclude, lifestyle, dietary, and supplement changes can not only help solve the symptoms, but also the cause behind the condition. These natural therapies have good tolerability and a favorable risk-benefit ratio for the treatment of indigestion or functional dyspepsia. I hope you found this video helpful. If you did, please give it a thumbs up. Please also subscribe to this channel if you want alternative ways of healing different disease states, and also there are recipes for plant-based foods in my channel. Also, please visit my website, thegorilladiet.com, for anything to help move your health and wellness to a better place and help you lose weight if you desire. Thank you very much for joining.